How would you describe engagement, the concept of engagement within your field of research?
As far as I know, there isn't really a concept of engagement as such. People talk about attention, but one of the interesting things is that the engagement issue seems to be kind of, not ambiguous is the right word, but there's no specific concept. We have concepts of memory and other aspects of cognition, but engagement seems to involve, I would say, attention, and that might be about perceptual psychology or cognitive psychology. Or do you mean engagement in the sense of social engagement, or engagement in the sense of when you have mutual gaze? So when two people look at each other, you can see they're socially engaged. So there is engagement, but it's not a concept that people study in itself. It seems to be on the edge of other concepts.
If you were to evaluate engagement within your field, how would you do it, on the qualitative way with open-ended questions and such?
One way of doing that would be naturally through questionnaire design. But this kind of speaks between the issue of implicit versus explicit measures, I think. And one way of measuring engagement would be through sort of the attention paradigms of looking at latencies of gaze tracking or through eye tracking methods. So the more engaged you are, you could say, the longer you look at something. But that's kind of quantitative. Qualitatively, you might ask somebody how engaged you are, and you could have questionnaire design. That's the only way I can think of it, or maybe some sort of focus groups or individual assessments. And what's interesting is that there might be a mismatch between how engaged somebody says they are compared to how they really are. And therefore, I think it's important to have these kind of two measures, if you like, these implicit and so-called explicit measures. I think also with the measurement of engagement is this concept of relativity that you have. So each person has an individual baseline. So I don't think you can measure engagement in one shot. There's no silver bullet. So imagine if you have one person who has a different threshold for engagement than another person. You have to have that person as their own baseline. So these studies, I think, are within subjects' designs. So in a sense, with engagement, you're not talking about absolutes. You're talking about relative. Relative to the person's own baseline, because some people may be more engaged naturally than other people, and also relative to different conditions, different games, if you like. So I think crucially to this, the measurement of engagement is not about taking an absolute measure, it's about a subtraction from some form of baseline. And when you work with very young children, with infants, you can't ask them explicitly, so you have to take implicit measures, for example, of their gaze direction, or with infants you have sometimes a non-nutritive dummy. So you put the dummy in their mouth and you show them pictures, and if they suck more, it suggests, or if they can very impressively, very young children can change their sucking patterns either to increase or decrease depending on what stimuli they get. So for example, very young children, newborns, can tell the difference between their mother tongue and another by sucking. So for example, so in the womb they hear their own language, so Danish or English or whatever. So in an English-speaking country, the children will suck more or less, depending on how you set it up, to hear English. And they can tell the difference between English and Japanese, English and Russian, but not the difference between Japanese and Russian. So you have all these implicit measures. So the sucking paradigm, the gaze paradigm, all these things are trying to take measures that you then imply suggest that they are differences, so that they know.
That's really interesting, actually. And within the field of autism, do you have some examples of how to evaluate, not only engagement, but different methods of going in and
I think
it's something about feelings or, frustration, or, there must be something...
about engagement?
Yeah, it's related.
It's difficult because, I think from when we spoke before, you talked about the difference between motivation and engagement. So motivation seems to be a bit of a lower level, whether you do that in the first place.
Yeah.
And often you get a mismatch in autism between motivation and what people measure as their performance. So, for example, if you have a measure of intelligence,
Yeah.
you have to assume that that person is motivated to do that measure of intelligence. So you give them a test of intelligence, they do it, and you get a measure of their intelligence. Now imagine if the person is not motivated to do it. You still do the test, and you get a low score. Is that low score because they're genuinely not intelligent, or not so highly intelligent, or because they're just not motivated to do the task? So autism is a very interesting case whereby often you get this real mismatch between implicit and explicit measures. Because very often if you give, for example, IQ tests, that's just one example, you give it through a social medium. Somebody has, the tester is a person who gives that. And if you don't like being around people, or you find that difficult to be around people, then you're going to get a misscoring, a misalignment between your actual performance and your underlying competence. So it's a real challenge when you're looking at very young children because they can't speak, or special populations like people with autism, because you make assumptions based upon the typically developing the clinical normal populations that you then have to challenge in your measurement.
So actually the next question is about how you would measure engagement quantitatively. You already gave the answers because you do it kind of indirectly, you know, by the dummy and so on.
I think that's probably, I wouldn't say the best way, but along with qualitative measures, I think you need a holistic measurement box, if you like, a box of tools. And what you're really looking for in psychology is convergence of evidence. So you have multiple mouse clicks, you have pressure, you have eye gaze, latency looking. You also have this violation of expectation paradigm I mentioned, whereby you have a baseline of habituation and something changes and you look over.
Could you tell the example of that?
So the classic example is when you give children an impossible physical event. So previously people thought that children only understood the physics of the world relatively late on in childhood, maybe 5, 6, 7 years old. But then you can ask the children about how you understand that objects go on to continue to exist even though you can't see them. However, people have argued that implicitly children know this, but you just can't get into that measure. So you need to look at younger children. So they give them an impossible drawbridge event which goes through a physical block. This is René Bayagian, classic study. So the children are sitting on the mother's lap and they see a drawbridge come to an object and stop. And so the children see this object and they realize the laws of physics are being obeyed because objects can't go through one another. Then, once they're habituated to this, an impossible event occurs, and the children look for longer when that event occurs. And the implication is that because they look longer, they have already built up a representation of what should happen, and when that doesn't, it violates that. And the implication is that they then have this early concept of physical understanding that objects can't behave in this way. You can't ask 1-year-olds this question. So just because you can't ask them the question doesn't mean that they don't know the answer. So you have to find some imaginative ways of doing this.
Yeah, and here you have a metric actually, the time of the focused gaze.
That's right. You have a clear metric. Previously people videoed the children and just took a stopwatch. Now, perhaps not with very young children, but you can certainly use webcams to look at eye gaze and look whereabouts, and you can get some reasonably accurate data that doesn't require you to put a head-up display on the child.
This is a little bit out of the questions, but I just got this idea of asking you, with people with autism or Asperger's, their way of being motivated in relation to ITC. Has there been done any research of that, or do you know any ideas? Because I think it's interesting in when we investigate motivation and continuation desire, that maybe they are clean brains that are free from all the social elements and all the others. Do you know what I mean?
So I will say I'm one of the pioneers of this research area.
Yeah.
And I made an argument in the late 90s about ITC being the preferred medium for this group because lower bandwidth, not so busy with noise of information, of peripheral things coming in. And so if you look at text messaging and instant messaging and email, it has all the information but without all the other things that come with communicating with people, all the difficulties that you have to process all this information. I don't know, there's growing evidence to suggest, some of it's circumstantial, that these individuals prefer to communicate via ITC computing technology in some way. And certainly it would be, and I think for those particular reasons, that top-down knowledge, that clearer mind that isn't influenced, they might have a qualitatively different way of interacting.
Yeah, it could actually be interesting to, if we find a measure, if there's a difference between when they play games, they also love to play games, and when normal people who do not have Asperger's.
So I think that would be a very nice experiment once the paradigm and protocol is set up.
Exactly.
Because I guess that's the way it works in my field. You set up this paradigm with a typical developing group, you think it's going to go one way, you refine it, and because the autism group is precious in the sense there are so few of them, once you've refined your paradigm, you then use it with that other group, and then you see whether they're influenced in that same way by their top-down knowledge or not.
What do you think about the method of using the visual analog scale? You know, the VAS scale, where you say that, okay, if 0 is the less painful or less engaging, the most boring thing you ever tried, to the most engaging or most painful thing.
I like that methodology because the other way of doing it would be through some sort of Likert scale, whereby you have 5 points or 7 points. And there was a paper I was only reading this morning, which I remembered after our discussion on Monday, by Bernstein and colleagues, who used a classic, reversed a classic experiment in which you have a binary yes or no, and then they produced an analog scale. And beautifully it was a sandpit. And so the children, whereabouts the children put this thing on the sandpit, they then could measure. Okay, for that kind of scale, people are probably not going to use it as a pure linear scale. There's going to be very little at the end. You're going to get bunching in the middle. And you have some sort of distribution like that, some sort of normal distribution. So it's not going to be, but I think that's a good way of doing it. I certainly think it's useful to maybe explore that a little bit more and find out where your scales are. But I think my gut feeling is that that's preferential to using the kind of classic Likert scale. Because then you can get more fine-grained analysis whereabouts they put the tick on.
Yeah, exactly. I think also we're going to use that actually, and within the game actually, maybe, you know, in order to go to the next level, you just have to put the slider up or down.
Like that. It's fast.
Yeah. It's not so intrusive.
It's not so intrusive. And you can then simply take a measurement of centimeters or whatever and see how that is relative to that person. And also, you'll be able to get more fine-grained adjustments. So even if they smooth the scale a little bit this way, a little bit that way, in a sense, if you get data like that, and you have lots of participants, you might be able to self-norm that data.
As you know, we try to look at one aspect of engagement, which is this we call continuation desire, right? Have you stumbled upon that concept or that aspect of motivation or engagement?
Not really, no, because in my field, I think it kind of stops at motivation, at that beginning point of when you're going to do something.
Yeah. As soon as you're in the process, then it's okay, because then
so.
you got started, but you don't look at it inside the process.
That's a very good question. I mean, I think social psychologists are perhaps looking at some aspects of this in terms of health behaviors. So I mentioned theory of planned behavior in relationship to smoking and driving and sexual health. So this is a paradigm used by social psychologists in which the most proximal thing to behavior is behavioral intention. So I intend to stop smoking. I intend to wear a condom. I intend to eat better. All these things are the closest approximation to behavior. So if you're looking at behavior change, you want to look at the closest proximity to that, which is behavioral intention. Feeding into behavioral intention are attitudes. So your attitude has to be right. I want to stop smoking. Your subjective norm around that, if that's and that's people around me and society thinks I should stop, and your perceived behavioral control. So if you say, I don't think I can stop smoking, that's going to hinder your behavioral intention, which then hinders your behavior. So people are kind of looking at this in terms of the behavior, but whether people are following up while people are in it, the motivation to continue is interesting, because I think it's so difficult to get people to change their behavior in the first place. Follow-up studies afterwards will measure whether it succeeded, but not within that gap. Can you imagine? So you understand what I mean?
Exactly,
so you have a government advertising campaign about stopping smoking. You see where this point in time, whether it has had an effect, and then you see whether it has an effect afterwards. You don't look at the process. And this, I think, is one of the beauties of this, your paradigm, if you like. Because more broadly, you can measure the process of what's going on at that moment in time, specifically with computer games. But I think it has something to say to psychology also. Because often in that window, you're just taking two discrete measures, one point A, one point B. You don't know what's going on. You don't know whether it's going up or down or whatever. All you're looking at is it efficacious? Does it work? 50% of people who say they stop smoking then stop smoking, continue to stop smoking. You're not looking at the process of whether they had 5 in one day, gave up 6 in one day. And I think that process is crucial because you're missing all that information. And the big criticism, for example, in driving research is that people do a lot of questionnaires, but you can't actually follow somebody while they're driving to see if they're doing what they say they're going to see.
So observations.
So that's crucial. So often in big journals, people don't get their questionnaire studies published because the reviewers say, all well and good, you did all this, but we have no evidence to suggest that the person actually did the behavior. That would be a big change if that could be done.
So a crucial thing would be actually always to have some videotaping of the person playing the game.
Absolutely.
That's a cheap one to have actually, because we can always have these things going on.
So for example, if you're in a psychology department and you have a driving simulator, you'll get that work published, probably. If you're not, and you don't have that, you possibly won't. But it could still be really good work. But people want to see that what you say is going to be doing has been done. Even better still is if you could follow the person in their car. But if you have that difference between what people say they're going to do and you have that observation, I think you could do that, no question, in the game itself.
That's really good, because the thing we got to yesterday, Sandy and I, were about if we can get quantitative metrics from the game, as you said, for example, with mouse clicks and mouse movements. You know, you look around if you want to explore things or something like that. And then we talked about the time being in the same area of this world, something like that. You know, the speed of movement, how fast you're going around, and how much the traveled distance, and things like this. You know, we have a lot of metrics there that we can get automatically. And then we have, as you say, observations. And then if we put on the EEG thing, and actually a guy, a PhD student of Sandy's, he had a measure from NASA, where they can actually measure engagement. They call it engagement among pilots. In order to make sure that when should the autopilot take over if it's suddenly, you know.
So it's fairly crucial.
So and my suspicion is that actually we can go in and say some of the measures of engagement could be just the amount of brain activity, because although I've heard that if you look at a white wall, you have higher brain activity than if you look at a TV series.
So I think you have to be careful, as I mentioned before, in interpreting these brain behavioural measures. But I still think it's useful to potentially take, because then you have triangulation from a different methodology as well. But I think we have to be careful in your interpretation of that, because as you say, you could get less, but that could mean something entirely different.
exactly. And also you might have so much activity because you're shocked of seeing a horror film. Ah, she's engaged. No, she's not. She wants to get out of there now.
Yeah.
She's totally disengaged. So that should be correlated with the observation, or related to the observation and the metrics. Because if her eyes are, her head is turning that way, and the film is going up there, maybe, or like this, ducking down, then you could say, okay, then it's not like that, right?
So in psychology, what mitigates against this is that you have predictions that you make. So if you're not betting on all the horses, you think, this is the one horse that's going to give me my measure, this is another one that's going to be the right one. So you make some a priori predictions, and then test those predictions against what you believe. And then that will help you avoid making erroneous conclusions by saying, for example, okay, this is showing less, therefore it means less. You have to have a justified reason for why you believe it's going to be more beforehand. And then if your data doesn't fall that way, you have to reinterpret that in some meaningful way, given what you previously said was going to happen. And also, I think what I touched on before, it's looking at that process, which is crucial, I think. So one of the things that really interests me is how people do things differently. So Williams syndrome, I won't bore you with the details of Williams syndrome, but it's a developmental disorder. And these children are kind of like the opposite of children with autism. They have relatively good social skills, but not so good visuospatial skills. And one thing that people found was that they're pretty good at facial processing. So if you give them a standardized test of face processing, they do okay. What they didn't do was say how they were going to do it. So what you need to do is do eye tracking studies to see what the process is, whether they're doing that in a qualitatively different way than somebody else. So even though they get the same score as someone, are they doing it in a different way? So it's the process that tells you something about what's going on.
Yeah, exactly.